I appreciate the opportunity to have what I will call a keynote conversation with you because I don't really think about this as a presentation or a speech. And if you think it is, then you have the wrong guy up here for sure. I was a little bewildered when I got the invitation and about exactly the perfect relevance that UnitedHealth Group's experience might have to all of you. And it crossed my mind that you might have been desperate for a speaker of some sort. But I then turned it around and thought that if, in fact, we could have a productive conversation, that would be a pretty good use of time. So I'm not going to give a 20-minute infomercial about UnitedHealth Group. I'll give you about 2 minutes so that I can give you a sense of kind of the scope of the enterprise so you could get a perspective of what we see in the marketplace. I'm not going to dwell on healthcare politics or policies in particular. If you want to get into that a little later on, that'll be fine with me. I'm prepared for that. But I'd like to take a day off from that and talk about something else. So I'm going to keep it short. So the quality of this conversation will be very much around the quality of your questions. I will start out with a couple of minutes about UnitedHealth Group. Its mission is to help people live healthier lives, and that really is a mission that is deeply felt. And the role of our business is to make the healthcare system work for everyone. So you'll see in a minute that we're kind of displayed across the healthcare landscape. UnitedHealth Group is organized around 3 underlying competencies. What I'll call domain knowledge about how healthcare resources might be optimally organized and deployed so you get the maximum productivity, best outcomes, best efficiency from them for the most people in the marketplace. The use of information skills to take the enormous volume of data that's characteristic of healthcare and be able to translate that into something that's actionable, what we call actionable intelligence in healthcare, and connect it into the system. And then lastly, enabling technology. So we think of ourselves as a bit of a healthcare system, perhaps a more modern, more virtual kind of business that is organizing resources in local markets, recognizing healthcare as profoundly local, and that there are meaningful differences in local markets, that we are connecting it with enabling technology, that we are informing it with information that is relevant and trying to bring it to the point of decision making for both the consumer and the care provider, so both sides of the supply-demand equation. And we do that through 2 basic business platforms, 2 domains. One is called UnitedHealthcare, and that is our benefits business. It serves, in total, just over 75 million Americans, individuals, about 40 million in full spectrum of major medical, and the balance in a variety of other services or parts thereof, but the 75 million unique. It serves the commercial marketplace in all sectors. It serves Medicare, Medicaid, the military, and it would be the market leader in all those categories. And the other side of the business is called Optum, and it really focuses on the health services domain. So working with 6,000 hospitals, 70,000 pharmacies, 250,000 practices in the country, 300 payers, 400 life sciences businesses, 300 government agencies. That business is really into the kind of the central nervous system of the healthcare community. Again, using technology, using information, and using domain knowledge to see if we can advance the system in total, make it more modern, make it more effective, more productive. And we deploy against those 2 platforms, one much more regulated than the other, one much more mature than the other. And in total, we think about it as being about 75 million Americans connected very structurally to about 85% of the healthcare delivery system in an open market kind of context, 750,000 physicians, 5,500 hospitals, 70,000 pharmacists, 1,000 labs, about $110 billion in revenues in total, about 115,000 employees. Interestingly, 16,000 of them are totally dedicated, are clinical in their background and totally dedicated to clinical services. About 12,000 are totally dedicated to technology. We are a major technology user. We spend well over $2 billion a year in technology to make that system I describe work. And that system is the size of a good-sized country. Great Britain's got 62 million people, France has 62 million, Germany's got 80. So it is an interesting model of a healthcare system. That use of technology helps us capture data and use it effectively. We transact at a very high level. We have about 80 billion transactions a year, about 1 billion of them on the internet. We have a consumer database that it tracks about 170 million Americans, and it tracks them over meaningful periods of time. And it's an organization that we think is innovative and has increasingly become more innovative. I think it has natural instincts along those lines. But we really tried to open them up in the last couple of years, and it'll get to kind of the core of the message. We were a winner last year of the Product Development and Management Association Award, the PDMA Award, which is, we think, the first healthcare company that has actually been the award winner in that domain. We were Fortune's most admired in managed care for the last 2 years. So it's an interesting place on the field, kind of somewhat in between supply and demand. We are, in many respects, making a market in healthcare when you think about having a transactable base, our technology, using information to make that market more efficient, and then working with the assets across the supply-demand continuum. That is kind of the model of UnitedHealth Group. And so it strikes me it might be relevant in terms of if I was talking to my own folks today, which is when you look at the content of what I'm going to touch upon, could easily be translated directly to them. The same things that are hitting us, we think are very much connected to you, and we're kind of in this together. So what are we seeing from our spot on the landscape? And it's pretty simple. Consumers, employers, governments are all demanding much, much more than they ever have before out of the healthcare system. A sea change from that perspective. We are seeing more change in the marketplace. We're an organization that does a lot of study than we think we have seen in perhaps the last 30 or 40 years, which is about the time frame it's taken us to get to kind of this threshold period in healthcare. They are demanding more value. They're demanding more consistency in performance. They're demanding more personalization, higher levels of compliance. They expect our businesses to be able to comply with whatever regulations, whatever rules the market comes to. They're demanding greater levels of access, at the same time specialized or segmented kind of access, flexibility, choice, convenience, simplicity, personalized technology, information and education as they come into the marketplace, tools to navigate the healthcare system and make that, to help them make decisions, educate them and make better decisions, and transparency. They want to know our costs, they want to know your costs, they want to know how good our business is, they want to know what the quality and trajectory of our services have been. They're going to want to know the same thing with respect to the effectiveness of your products and services and how cost effective they are. Because at the same time, they want that more for a lot less. They pay today, on average, across our book of business, roughly 30 cents on the dollar, which is a significant change over the last 10 to 12 years in terms of how much the consumer is actually paying and is conscious of what they're paying in healthcare. They are asking questions that they have not asked before. And they're kind of irritated when they're not getting the answers. They want lower costs. They want to know how much something really costs. They want to know why it costs so much.